Thank you for Smartly to invite me. Thank you so much for the professor at McGill University. And it's a very pleasure to sit here with you and to share how my dental practice changed using from Smart. So today, as I talked to the professor, I have 400 slides. It's not possible to give all in 3 hours in one lecture. So I'm going to maybe to start explain you how the difference between Smartly with the other brands from Invisalign, what is the first or maybe is the number one today in the world. So and talk to you how is the different solutions we have in the Smartly for our practice. So we're going to start on let me to present by myself. My name is Dr. Vicente Torres. I am from Spain, from a city from Valencia, in the east of the country. So I do my bachelor's degree in dentistry a few years ago, in 2002. I finished it. So when I finished my degree, in 3 months I started my postgraduate program in orthodontics in the University of Valencia. And in the same university, I was a professor there and have my PhD in dentistry. In the University Europea, this is another university, a private university in Valencia. I was orthodontic responsible professor and right now a professor associate in this university. And for the last year until the present, I am called doctor for international and national lectures with Smart. So, in these 23 years, I treated more than 10,000 cases for orthodontic and orthopedic cases. So, in this, around these 10,000, 2,500 cases only with clear aligners. So, I think I know a little about how to move teeth with clear aligners. I think maybe the most of you are students for postgraduate program, all of you maybe are dentists with experience or dentists with experience with clear aligners. So you know the difference between how to move teeth with traditional orthodontic like braces and how to move teeth with clear aligners. So it's different, the biomechanical is very different. So it's very important to know how to move the teeth. And since 2019, I was, because until this June 13th, it was for top Invisalign Diamond category in Invisalign. So, in these years, so for example, the last 4 years, I was Diamond Apex. Diamond Apex is the maximum category in Europe for doctors. It's only the 1% of the doctors in Europe who treat more cases with Invisalign. So, only with Invisalign, I treat more 1,700 cases using Invisalign. Invisalign for 15 years ago. So, but it's not the only brand I use. I want to always say it's very important to use different brands to know how it works. Every brand is different. I always say all the brands, all the big brands are good, but every brand have different solution. So it's very important always to try to use different brands. For example, with Spark, you know Spark. Spark is a system with the Orco. Orco is one of the most biggest brands in the world with orthodontics. For this 2000, I think it's October or November of 2019, I was in the first worldwide certification with the first doctors in Madrid, gone with Dr. Diego Pedro, Dr. Iván Malagón from Spain, and this is the first worldwide certification. So I was one of the first doctors to start using Spark. With Spark, I treated around 300, 350 cases around with Spark. And with Angel, it's the same. Angel Aligner is another brand. So I started they come to Spain, they came around 2 years and a half or 3 years in Spain. So I treated around 200 cases with Angel Aligner. So I use different brands. And for me, this is a special award. So in 2020, so this is like, you know, in Invisalign have like an international gallery when the doctors come to submit their cases, and in Invisalign, they select the most maybe the most beautiful, the most important cases. And after this, and special doctors, these diamond doctors, they make these cases to evaluate and give some points, and the best cases they have on this award. So this award is for Europe, Middle East, and Africa. So in 2020, I have my award for the third best case of this gallery. This is for me two important things. The first one for me is an honor to stay here with two amazing doctors. Dr. Martín Pedernera is one of the most famous doctors in Spain within Invisalign. Dr. Kami Malekian, this is a special because was the first doctor with the first case in Spain within Invisalign in 2001. She used the first case in Spain. So, and here, let's say, the other important thing, this is Europe, Middle East, and Africa. And you can see here, the three doctors are from the same country, from Spain. So normally in Spain, the level of the orthodontics is very high. It's very high. So for me, it's an honor. So, and one of the questions the doctors always tell me, okay, Dr. Vicente, and now what you are using Smarty? Because right now, around 100% of my cases, I start with a Smarty. I meet a Smarty like not around, one year and a half, more than 1 year and a half, in February of 2024. I meet a Smarty in the European Aligner Society, and I will explain you, I like to test a lot. Okay, a friend of mine, they say, no, you need Vicente to start to use Smarty because it's a very good system, they have different solutions. Okay, let's go to start. So when I go to start this, in the first case that I submit, you can see here my first case is in April 9th of the last year. I feel the difference. Why I feel the difference? Why, for example, when I submit a case with an Invisalign, for example, normally the technicians, they don't have experience. Sometimes 1 month ago, this technician is working in another kind of work, in another job. Normally in Smarty, all the technicians technical for prosthetics, or minimum. There are a lot of dentists and orthodontics, but every case before I arrive to you, they always have an orthodontic to review. So normally the cases when this technician is very good. So in this case, I remember they say, okay, I'm going to be bad. I'm going to be only to say because I have a crossbite, posterior crossbite in the 16 and 17. So I only to ask, okay, correct the crossbite. In the left side has a class 2 malocclusion. I don't say nothing about it. So the technician put me only for a precision cut for a bottom in the right side. They make the movement sequentially. The first to correct the crossbite of the 6, the second the crossbite of the 7, and they put me there in the right side the elastic for class 2 malocclusion. So this is only, I don't ask nothing about this. In another brands, in Invisalign, for example, this is impossible. It's not possible. Within a Spark, for example, in a Spark, they normally don't put any attachment on molars. Any. Never attachment. So it's very complicated. You have like a molar with a 10 degrees of rotation. This is impossible to rotate a round teeth only with the clear aligner, because you know one of the most complicated movements is in round teeth, premolars, canine, molar. This derotation, you need normally an attachment. It's very important. So this is for me, is the first thing they see. Okay, Smarty is different. Starting with this, I start to use different solutions. I go to China, I see the factory, an amazing factory. Right now, I show you a video. So it's very different. Very different. So you can see here, you have the brochure, you can see all the different solutions that I'm going to explain you after. So, right now, my first case, in fact, I hear from 1 year and a half, I have more than 400 cases with an Smarty. And the other thing is very amazing, is the treatment for young patients, for growing patients. This is an amazing. I don't know if you normally treat growing patients with clear aligners. So if you can, please start, because it's the best way to treat. Normally, I remember 10 years ago, 12 years ago, my treatment with growing patients normally is with the quadralegs, the disjunction, the lingual arch, the putting 4 braces, or maybe the Howley, or maybe an expansion plate, or similar like this. Right now, with the Smarty, it's very easy. Very easy and very predictable. Very predictable. So, for kids, for example, these 400 cases might treat around 126. So, 1/3 of my cases are with growing patients. You need to start. Not only because you have maybe a package from Frozen, from Spider-Man, Iron Man, wherever. So this is the marketing. Well, it's true that normally the kids, they have more confidence, no, using like this, but this is an amazing to treat these patients with this kind of clear aligners. Well, so let's talk about the Smarty. When you're thinking of Smarty, or when I meet a Smarty, I know a Smarty before because I'm very freak of the orthodontics. Maybe I know all the brands of the world, maybe not all, it's quite complicated, but the most of. So when I go to a Smarty, I want to know more about Smarty, I think, okay, this is a new brand. It's not a new brand. Spark is a new brand. Spark started in 2019. This is a new brand. Smarty started in 2004. It's 21 years ago. So it's a brand with a lot of experience. In fact, the company foundation, Mr. Yao Junfen, is in 2004. In 2007, in 3 years, only they dedicated from investigation. On investigation in 3 years. They start to produce aligners at the beginning. 3 years of investigation. In 2010, they start with the 2 plants in Shanghai, in Shenzhen. So 5 years later, they have a Ronda with a very strategic group, the Cabo group, which is including here is an Vista group. In 2017, they start to apply the new technology for new solution, the S1 until S4, and another round of funding, and starting to the semi-automatic production. So like this, every year or every 2 years have a new features. So, and this is the video from the 20 years of innovation from Smarty. See, the first is Mr. Yao, the first one, to start only. So right now Smarty have this amazing factory They have 100,000 square meters. This is amazing. Peter Professor stayed there. It's amazing how it works, how the automatic is all full automatic, the process. So it's very amazing. And right now, Smarty is in more than 57 countries, more than 1,600,000 perfect smiles, and more than 91,000 doctors using. And is the brand that have more patents in China. It's the first one. So of course, it's very important not only to manufacturing aligners, to have the certificates. So this brand have all the certificates to use in the different countries. The FDA from the United States, from the certificate from European Union, the ISO from England, from Australia, from Japan, from all the countries here. So it's very important, the certificates. The awards and recognition. Okay, a lot of recognition. I want to stay here to say all of these awards. So, and is the only brand that have a Disney official license. So, it's the only one. So it's very, I think it's, like you say, it's a marketing, but it's very important. Because, for example, normally for kids and not for kids. Because for kids, you can package from Spider-Man or from Frozen, but for not kids, you have Iron Man and Mickey. And Mickey, for example, is crazy. I have my adult patients, normally the women, they like a lot of Mickey. So I have all my adult patients, normally women, they prefer with Mickey. And this is, right now, the 3 manufacturing basic. One is, let me this. Yes? Perfect. So, the biggest one is in Shenyang. So this is the Smarty was the first company to introduce the industrial 3D printing, the first one in China. The second one is in Dental Valley, in China, Dental Valley. This is like where all the, in China, in every region, they have the different. For example, you have for the dress in the region, from the mobile is another, and the Dental Valley have another part. Here in this, all the factories like Spark, like in Invisalign, the Angel have in the same area. Smarty have another factory there. And for me, this is the best one, because we have outside China, we are the only country that we have a factory outside. So this is an amazing for us, for all the Spanish people, because normally we, when we approve a case, normally in 4-5 days, we have the likeness in our office. So this is amazing. So this factory is for all Europe. In the idea of the Mr. Yao, it has factory in each region. So factory maybe in the future in Australia, maybe factory here in Asia, factory in South America. So to be all the deliveries from the manufacturing very quickly, very fast. And this is how it works a Smarty automatic production line. you can see, for example, all the people think that sometimes the liner is printed directly. This is not true. The printed directly, right now, the most famous brand that printed directly is Graphi. You know Graphi with Dr. Kenji Ohima. Graphi, for example, in Europe, they don't have the certificate because right now they have a lot of problems with allergical problems because you need to make a wash, you need to make a photo cure, so it's very complicated right now. Right now, the brands always print the model in resin, and with this model, you make the aligner. So this is very important. Maybe the future maybe it's to print it directly, but right now, the present, right now is complicated. So this is the best way to have like our clear aligners. So the other thing is the very, very and amazing different products. Different products that start with the GS. The G is for normally for the you are going to use G cases in the 80% of your cases is G. Alpha cases is for special cases, not for all the patients, because you use aligner normally when you are a day and other aligner for night. Well, it's the same aligner, but different for day and different for night. This is to make more faster movements. Not more faster because normally the algorithm, the movement is the same. 0.25, 0.20 millimeters per aligner. So this using two different aligners. They use one aligner per day is more soft, and the aligner at night is more little more hard. So they make all the movements are more predictable. So you use these two kind of aligners. The GE and GS, the special GS is for mandibular abutment in adults. So this is an amazing. This is the only brand that have mandibular abutment in adults. And teen and kinder is special for kids between 3 until 10 years, and teen is between 3 until 16 years. You can see, okay, teen maybe is from teenager. A kid for 3 years is not teenager. So this is the only difference from this packet is the mandibular repositioning. In this case, teen, you have mandibular advancement, you have occlusal splint, anterior or posterior. This is the difference between. Okay, the G. The G you would have inside this package, you have 4 families. Express, light, it. Roll with the figure. Okay, so this kind of package, what is included with the different specs? Okay, the software. We have the SmartyCheck. With this SmartyCheck right now, this software is, for me, is one of the best software right now. It's one of the best. Why? Because you can do, of course, move all the teeth with 3D. You have live update. Live update you can do in the same moment you are to review the case to make change. You can press button and at the same time the actual. So you can do approve your case in 10 minutes, 15 minutes. So it's very, very amazing. The iFast is for example, if you want, it's like I use more for marketing for typical patient that, for example, it's come to your office. They say, okay, doctor, I want to be my orthodontic with clear aligners. Okay, you have 5 minutes. Yes, you do the scan, and this iFast you upload the upper and lower HTE model. Automatically make a pre-visualization of the final position. So this is for marketing, but it's very good. For example, in my office, when I come patient for the first time, I always do photos, extraoral and intraoral, orthopantomography, teleradiography, and scanner. So with all of these, you can say to the patient, okay, your treatment maybe, okay, we need to make a study, it's very important to make a study, diagnosis, the treatment plan, but normally when you have experience, normally in the moment you can just say to the patient, okay, your treatment maybe goes here or maybe goes here, or if you have to do, maybe you are here, extractions, non-extraction cases, and more complicated cases. So you can to use this iFast to show the patient the final result. But I always say, the real is better than the fiction. Normally this iFast is in 2 minutes, you have the final result. So with you, the Smarty check is better. The root visualization, because we integrate the CBCT, so you can see how to move the roots. If you are going to move the roots outside the bone, or maybe not. So it's very important in complicated cases. The cephalometry is very an amazing tool, it's automatic. It's important to do always the cephalometry than the traditional, okay? Because you need to know where is the points. So when you have this, okay, you can use a program like this. They put by AI directly, so maybe you do some chains. The predefined results evaluation, the Smarty Doctor APP, the life update, and this is another amazing, the oral health report. This is the only brand they have, is Smarty. What is this? Explain you after, but this is, you upload the photo of the patients, you upload the orthopaedic therapy, and they will give you like a health report, an amazing health report. So you can give to your patient, okay, this is your health report. And the patient say, okay. So when you come to your office, you make the photos, you make the radiography, you make the HDL, so you show the patient the final result, and you give to the patient the oral health report. You're giving a lot of information, so the patient, okay, this is my doctor, I want to treat with you, because you are giving all the information to the patient. The different solutions, the medical team, so the dental designers, and the material. The material is very important. Why? Because in all the brands maybe always they say the same. My material is the best. Okay, be careful with this. Because for example, Invisalign, my Smart Track, my material is the best one. Okay, your material is good, it's very good material. But this material is soft. Normally, when you think about Invisalign always sell us the material with this soft is better because it's more comfortable. It's true, it's comfortable. But what's the problem normally with Invisalign, in my experience? My experience when you do expansion with Invisalign, the problem is you create a posterior open bite. This is in a lot of cases. And what's the problem? The people say, okay, the clear aligners create a posterior open bite. This is not true. Why create this posterior open bite? Because when you expand the molar, normally the problem, the molars don't expand at the same time. The problem is have a crown, the crown is like the palatal cuspid is going down, so this going down create a posterior open bite. But this is the problem. What is the problem? Maybe you need to make an overcorrection, maybe a buccal root torque, normally 5, 7 until 10 degrees overcorrection. But for example, with another material, with the Smarty, did not happen because it's better for the movement. So be careful when all the brands they say my material is better. You need to try to say things. The other, for example, Angel Aligner and Spark. Angel and Spark using the same material. It's Centura material. It's the same one. So they say, no, my material is better. No, it's the same. It's the same one. And Smarty has his own material. His patented material. It's true, it's not sharp, it's a little because it's, I think this, maybe the layer is 0.7 or 0.8 millimeters, so it's little more hard. But it's, for me, it's better. At the beginning, the patient is true that when you say, okay, this is very hard, and maybe to remove is complicated. So at the end, the movements are more predictable. So it's very important. Okay, the Smarty digital workflow. Of course, we can remove the teeth by ourselves in 3D dimensions. Okay, the iFast. The iFast, you have the patient, the HDL, the beginning, and in 2 minutes you have your final result. This is compatible with all the scanners. It's true that Smarty have, for me, one of the best scanners. I have 3 scanners on my office. I have the iTero 5D Plus Mega Ultra wherever, but the last one before the Lumina. I have the iTero Flex, and I have the Alistar ES200. So for me and my assistants, the best is this one. And it's the cheaper, it's not compared. So this is an amazing. So, but you have another scan, it doesn't matter the brand, it's compatible, don't worry. For example, this is how to submit a case for iFast. You put the patient name, the date of birth. In this case, if you want to trade, if you want to allow the IPR in the upper or the lower arch, if you are doing distraction, in this case, for example, if you are doing distraction of the third molars, if you want to align all the dentition only 4 to 4, you upload the upper arch, you upload the lower arch. So when you have, you submit, and with this, you have your iFast in 2 minutes. So I always explain to the patient, this is a simulation, it's not real. Normally the real situation is better. Right? For example, normally the expansion of the arch with this kind of program is not predictable. So, but you can see here the movement, all the movement, intrusion, extrusion, rotation, torque, speed, wherever. You can see everything that you want. And for example, in this case, do an IPR 0.1 or 0.2. So you can to allow or not allow the IPR. The life update, for me, one of the amazing tools. What is life update? For example, you have your treatment plan. In this case, for example, I want to correct this posterior crossbite. And in this case, I have two amazing tools. The first one is, for example, if you have a teeth and you want to move an extrusion, for example, okay. I'm going to pause 1 second. You can see here in the attachment, there is an option, is auto attachment. Auto attachment is detect if you are, for example, in this case, you are doing an extrusion. You know, extrusion movement is the more complicated movement. The extrusion normally they need an attachment. Maybe the attachment sometimes they may be straight, maybe horizontal, of course, or vertical for extrusion horizontal. Maybe build to the incisal, to the occlusal, the different articles saying. So the most important is not what is believed, is the horizontal attachment. This is the most important, horizontal. So in this case, do you think this extrusion without attachment is possible? The answer is not. It's not possible. It's not possible. So when you press the auto attachment, what happens? The system automatically puts your attachment, but not only in this teeth, in all the teeth that, for example, they need with this movement. You can see in green the different attachments. The other thing that have an Smarty, for example, is the IPR. The IPR, you can choose when do you want to do the IPR. For example, in my protocol, I don't start using IPR at the beginning, because the first time the patient is coming to my office, I put the attachment, I know how to explain how to use the alignment. So doing the attachment, the IPR, all the same day, maybe for the patient is complicated. You are telling, no, the clear alignment is amazing, it's very, it's no pain, it's more beautiful, it's more clear, whatever. And the first time you do a lot of things. So I prefer to wait. I prefer to do the first day the attachment and maybe a month or 1 month to do the IPR. So every protocol is different. This is my protocol. Okay, come back. Okay, and here I save and press live update. Normally you can see the system tells you is around between 20 and 150 seconds. Normally it's not more than 20 seconds. The animation is updated automatically. So in around you can see in 20 seconds we have the new one animation. So with this new one animation, you can to approve directly if you want. So this is the animation, and you can see here the new attachment. They change the color, the green to red one. And if you want, you can to approve. Of course, I don't want to approve this. Notice this movement. So, and right now we are working in Smartyn. We have another option. Is the passive aligners. What is passive aligners? Passive aligners is, for example, in all my cases, in the first case, on the press treatment plan, I always ask for final passive aligners. Why? Because it's true that the Smartyn is very clear, and normally it's complicated. So the patient, maybe if it's small with the liner, or maybe it's taking tea or coffee or whatever. Normally at the aligners may be not clear, no? They may be dirty. So with the passive aligners, I always ask for passive aligners. Why? Because the patient is waiting for the new one, for the refinement. They have new aligners to change every week or every 10 days. Okay? It's in your protocol. I told you after what is my protocol. But with this, we have this animation tool, the auto attachment. It's automatic, and normally the system have autosave. So normally 3 minutes until 3 minutes is automatic saved. So right now I think in the next maybe in November, there is saved automatically. Every change that you do is automatic. Right now, if you don't want to lose, normally I recommend to every maybe 2, 3, 4 movements save it. But normally if you forget it, don't worry. The software automatic by 3 minutes is saving all the changes. So you have here, you can see in every aligner the movement of each teeth. So this is the live update. The other, the iRoot or the root visualization with integration of the CBCT. The pre-refinement results, normally I don't use this solution because it's only if you, for example, if you have a case it's not going well, so you can see, okay, what is the problem? In which teeth is the problem? Normally you can see teeth have no good adaptation. This is the teeth problem. So in this case, for example, you are in the aligner, for example, 22. You can make an HDL scanner, and you compare at the beginning. You compare what is the ideal situation, the aligner 22, with the real situation, and you have the movement completion with the radio. And for example, the cephalometric measurements. This is another amazing tool. For example, you upload the cephalometric, you enable the automatic, and this is one of the best automatic programs. You can see here, this is all automatic. It's not only like a hard tissues, in soft tissues, and the highway, the area. So, for example, if you want to know with the study of the bone, you can upload and you can see all. And you want to change some point, it's very. You heard me here? Better with my microphone? Yes, no? Okay. So, this is another solution. Well, the oral health report. The oral health report, this is, for example, you can see it's for you, for your diagnosis, and, for example, for give to your patients. So, how to submit, okay? You put the name of the patient, the age, maybe you want to, or you know how is the clothing you can use, or maybe it's undetermined. You choose your office, and here, maybe if you want that the software give you a recommendation from, for example, the recommendation is if you want a GS package or GT or Teen or Kinder, you can do the software give you a recommendation. So you can upload the different photos, the internal photos. The external photos. And the orthopalmography and the lateral. So, and this is in 3 minutes. This is your oral care report. You can see
มันดูออร์เฮลไอ้นี่จากไหน
ดูจากมือเขาให้เราเสร็จ
หรอ
So, you can see the malocclusion, the
Wait a minute.
endovascular occlusion, our teeth. You can see here the impacted teeth,
Oh,
the
AI.
canal, the maxilla, the condyles. So you have a lot of information. In fact,
จะดูจากพาโนนะ
if the teeth have a filling, if the teeth have caries, or if they have any problem, a root canal, analyze everyone. You can see how to segment the teeth very well, very well.
หนูรู้สึก
You have the class 2 left, class 2 right. So the gums.
เฮ้ยมันดูฉลาดนะแต่น่าจะใส่ใบวิ่ง PA ได้ด้วย
Or for example, if they think
โอ้โหรูปมืดขนาดนั้น
you need to check, but this is
รู้ได้ยัง
and this is
พี่แมวเหมาะกับมึงค่ะ
this program. This, for example, is the following. The oral health report. This is free, so you can use for all your patients. If you have patients from wherever, you can use to braces wherever, and you want to give to the patient this information. All this information is for you for your diagnosis. You can upload it and use for you. It's free. It's like the same. For example, I don't know
Come free.
how it's in China, but in Spain, for example, when you
แต่
upload
เซ็
a
ตมันน่า
case
จะล็อก
from
มาแล้วว่าโดนอะไร
Invisalign,
บ้าง
if you upload a case in Invisalign and you don't approve this case, they go to an invoice for around 300 euros in Spain. So with the Smart Team, you can upload a case. Maybe you can make patient decisions. Yes, doctor, I'm going to treat with you. And finally, these patients go out or not coming back there. So don't worry. If you don't approve this case,
No.
Smart Team, they don't charge nothing.
เลิศ
So it's for free. All of this is free. Oral care report.
คือเธออัปโหลดข้อมูลของใครไปแล้วมันจะ AI analyze ให้ว่ามันผูกมีเหงือกมีอะไรต้องทำบ้างผ่าตัดขนอะไรตรงไหนบ้าง แล้วถ้าเกิดไม่กด approve ก็ไม่คิดตังค์
This is a Smarty Doctor APP. This is, if you are more in your home, you can just see the patients in your mobile.
เลิศอยู่
เยี่ยม
And this is ADE, the difference. So
จริงๆเลย
the mini package,
แต่เขาต้อง
when
มี
I
เวลา
use
เปล่า
mini package, mini care package is only for special cases. So normally it's for advanced cases. For example, I treated a patient 50 years ago. So the patient is coming again, oh doctor, because I lost my trainer and I have a lateral incisor, a little problem. Maybe I have a little problem in the lower abdomen, wherever. So this is the mini package. This mini package is 10 aligners with 1 free refinement and 1 year of warranty. And you can see in all the packages we have 3 templates with reference, 3 templates. What kind of templates? The first one is like a normal template, more similar like in Invisalign. So, for example, in my assistants, some they love the Invisalign template, the other they don't like Invisalign template because it's more hard. So the problem is when you put the attachments in the posterior area and you remove the template, the alignment is going to the attachment is moving the template. So
In Smart you have normal template and soft template. Soft template is like if you use another system, it's more like a Spark mode. It's the same. I have a system they love with the soft template, another they don't like. So you have these both, normal and soft template. So you can use the new one. For example, for the anterior area, I prefer the normal template. That's perfect. The posterior area for soft template. Okay. You have in all the packages. And the third template
ที่เธอเลื่อนน้อย
is
มาก
the
ไม่
only
มีอะไร
template
ไม่
that
ใส่
has
ได้
smart.
ได้ซ้
Is the ACID
ำ
template.
แต่ถ้าอยากใส่ก็ใส่
So
ได้
you know, sometimes, for example, you want to use attachment, there is doctors, they use the acid in the all of the buccal side of the teeth. But there is doctors, they don't like in the exact position of the attachment. It's like with the brace, no? Braces sometimes use the acid in the exact position of the brace. So sometimes you make the acid in all the crown. So in this case, you have a special template for acid. And another important thing, the rotator set is included. In the mini package and light package is included the rotator, like the S6. One, in Express and Infinity, you have two pairs of rotators, two upper and two lower. So, this case, for ultralight cases, light. Light, Smarty says for light cases. For me, with light package, you can do a lot of things because it's 25 aligners with 2 refiners of 25 aligners. It's 50 aligners, 25 up, 25 lower. So with 50 aligners with 2 refinements of 50 aligners. So 150 aligners. You know how many cases you can treat with 150 cases, 50 aligners? So when you have experience, maybe the 50, 60, 70% of the cases you can treat with this light package. So, the Express package. Express package, you have 40 aligners in the upper arch, 40 in the lower arch, 80 aligners with 3 refinements of 80 aligners. So, 320 aligners, 160 per arch. So with this you can treat maybe 80%, 90% of the cases. So, and with this package is the same with light package, 3 years. 3 years, it's a lot of years. Okay? But if you are maybe at the beginning, no, I'm not sure how this package to use because I'm afraid because the expiration, the patient, the confidence, wherever. Okay, go to the Infinity package. Infinity package is infinity aligners, infinity refinements, 6 years. 6 years of warranty, 6 years is crazy. In fact, I always say, have a patient 6 years in your office is you don't take profit. 6 years one patient. So it's better to change the same 3 templates and the 2 pair of retainers. This is the ACID aging template. You can see here, you have like in the template, you have a hole for the acid. So you use the acid, you put the acid, and you put the in the template the soft or the normal, the attachment. This is the only brand where you have this kind of template. And this is very new for since like maybe 5 months ago. You have right now when you ask a G package, and it's only right now it's in G package. When you ask, for example, a case, if in this case you're going to do, for example, IPR, it's included the IPR, the bar, or IPR, the tooth push. It's included in all the packets. But for example, in this case, you are using, for example, class 2 elastics, and you are using bottom, for example, in the molars, in the lower molars, and in the upper maybe bottom or maybe like hood integrated of the liners. So it's including the bottoms. If you're using 2 bottoms, they give you a bag with 5 bottoms. So always is more than you need. If you are using, for example, a button, typical case, so you need to more crucial in the posterior area, and you are using 8 buttons, they give you 2 bags with 10 buttons. Always more buttons than you need. And in this case, it's more complicated case, and you have the typical case with a very big tip of the root, and you need to use a power amp. It's included the power amp. So they give you all that you need. So this is the only brand they give you the shot. You don't need to spend money in buttons or it's true, this is only under the first case. So if you ask a refinement, it's not included in the refinement, it's in the first case. So, and this is maybe the amount of tooth movement in different product series. So in the field, mini normally is the limit of the movement, light, express, and infinity. The alpha and the ES. So you can see here the infinity, this alpha and ES, the amount of tooth is the same. In the express, the limit is distalization and mesalization. For me, this is, with only 3 aligners, is impossible. The mesalization is one of the most complicated movements with clear aligners. So complicated. Why? Because when you remove the teeth, you move back, it's no problem. You move forward, the problem is the application of the force. So if normally it's up of the center of resistance, this move is make a tip. Mesial normally is cross going to mesial tip. So be careful with the mesial movements. Okay, let's go to a clinical case. I was to start with a very easy clinical case and more complicated case. For example, this patient. These patients come to my office for being treated like 12 years ago, including another clinic. And the typical case when the patient and have a relapse or they have any problem, and they say, okay, I'm going to want my beautiful smile again. So this is the improvement intraoral photos. And you can see here is a good occlusion, class 1 bilateral occlusion, midline maybe it's like not perfect, but near. So what's the problem? The arch form. That form is not typical oval form ideal, it's more triangular form and the closure. So it's not complicated case. They also tell it. It's true that in the telegraphy you can see a deep protrusion of the incisors. So it's true the patient is black patient. It's more typical in black patient is deep protrusion. In Caucasian, it's more like we have a retrusion profile. It's more typical. So in these cases, maybe if this patient was a concussion, maybe you can say, okay, I want to see a lot of idea or expressions. But if normally in patients, in black patient, for example, normally this is patient profile. You need to respect. So what's the treatment plan? This is my treatment plan. Make expansion, make a little reduction of incisors, doing an asymmetrical IPR, so make the center of the midlines, the lower midline with the upper midline. So very easy case. So this is posterior. Venous, form, rotation, extension, ortho, tele, and this is the change. See, yeah, form. So this case is with no refinement. Do you know how many cases, all of my 2,500 cases, do you know how many cases I treated with no refinements? Only 3. Only 3. One from Invisalign, I treated with Invisalign 1,700. One from Spark, very easy, but with a smart team, if I start this case, in this case, it starts on October 24. I finish in June 26. 8 months of treatment. No refinements. No refinements. So it's very, very good. Another clinical case, for example. little more complicated. Not complicated, but this case, the same. Dentition proline, arch narrowing, class 2 subdivision right, little in canine. In this case, for example, the patient has the third molars. Normally, I always say the third molars, they don't give you, they don't need to extract. If you're going to move sagittal movement, maybe you need to distalize the lower arch, you extract the lower. You distalize the upper, to extract upper. But if you have any problem, okay, leave it alone. Don't worry. What's the treatment plan? Expansion. Growing. You can see here, for example, the third molar. Normally the third molar in the scan is so complicated to scan the third molar, so don't worry, because if don't scan perfectly, normally the third molars I use for anchorage, so sometimes I make this tooth with no movement. I use only for anchorage. Okay? So, the first refinement, this is, you can see, we start July of 24, and the first refinement is in May of 25. In 10 months, we have this situation. Okay? Okay, finish. Here, make a conclusion. This movement, you can see complicated movement. Why? Because normally, the molars, when you have to do an extrusion more than 0.5, 0.7 millimeters, normally it's better use bottom and elastics. Normally it's more predictable. So, in this case, I use only at the beginning, I use only the attachment. So you can see here, because I want to try different things. So in this case, when I finish, I have a little overbite in the right side, and more little in the left side. So in this case, maybe it's finished, maybe the patient have 14 months of treatment. I see, okay, this is only with one refinement. I say to the patient, okay, let's go to do another refinement, okay, to improve this occlusion. The patient may know, Dr. Vicente. I'm very happy. The important normally for the patient, you know, normally is the aesthetic, the anterior area. The anterior area is perfect. No, I don't want to refine it. So, what I do in these cases, so the patient, they don't want another refinement. Okay, give me a chance, please. Give me only to put here 2 small buttons, and I cut the aligners, so I cut the retainers in the posterior area, and I use the elastics at night. So this patient is true is 2 weeks ago, they come, so maybe next time we can see you. But this, for example, this trick is an amazing. When the patient, they don't want a refinement, okay, don't worry. You put 2 buttons, elastics, and you cut the retainers, or you cut the liners with the molars, and normally in a month, month and a half, your occlusion is perfect. Perfect. So, another important thing, when you finish the case, normally we are usually to see a beautiful smarty shape, no? Or beautiful. So, in the contacts, always maybe green. We don't want to see like, you know, red is a hard contact, but blue is very hard contact. So sometimes we want to see beautiful smarty checks or beautiful clean checks or whatever the name. Okay. So in this case, if you have a posterior area or open, so you need to do a very hard contact. Don't worry. Don't worry about it. It's important, the overcorrection. It's very important. It's like, for example, when you have an overbite, a very deep overbite, like 100% overbite, when you correct this overbite in the smarty check, you need to maybe to finish with a little open bite. Don't worry, it's not a fear, but you need to finish with little open bite. So, beginning, and the end of the treatment. ACT. The Smarty Alpha. Smarty Alpha is like explained you before. They use two different materials, one per day, and to powerful like the movement of the signal. So you start, for example, for example, this 6:45 in Spain. No one is wake up. In Spain, we wake up normally at 7:30. So for example, you can start to use the aligner at 8. So use 8 to 8, the day aligner, and 8 p.m. to 8 a.m. the night aligner. So it's 50% faster, but it's not faster because the movement are faster. No, the algorithm is the same. It's the 0.20 millimeters per aligner, 2 degrees of rotation, and 1 degree of torque. This is the normal movement with different brands. The normal movement is like this. So it's the science, the same as how is the ideal movement. So in this case, it's 50% faster because the movements are more predictable and you use less refinements. So this is the idea. For example, which is the typical case of this? The typical patient comes to your office, oh, Dr. Vicente, a friend of mine recommend you, please, I want to be with you during my treatment, orthodontic treatment. Okay, perfect. But I have my wedding next year. Okay, we start back. I have only 12 months. Okay, so let's start. So I use this kind of package, the alpha package. So be careful, because not all the patients are indicated for this package. Why? Because I don't know how in Thailand, normally the Asian people, you are more confident, you will use, like we said, when you go to China, I see a professor organizing cases, very beautiful cases. If you got these patients to Spain, maybe you don't take these results because in Spain, you know what this is happening. So, it's different. So, for example, if you have a patient with a normal package and the patient you say, okay, how aligner are you using? I don't know. Sorry, which number aligner? No, I don't know, because I write always the day to change. No, that you give me, the last one. Are you sure the last one? Yes. Okay, remove the liners. And the patient is going. I take, maybe I give to the patient the liner number 16, and the patient remove. You can see because on the liner is the number. Okay, you are using the 15 in the upper and the 13 in the lower. So you have one more at home. Yes, of course I have one. But you tell me 5 seconds before that you have in the last one. No, I have one more. But you are using the 13 in the lower and 15 in the upper. Oh yes, because I broke one, I used the okay, wait a second. So what's happening here? So if this happens with a normal alignment, be careful, because this patient have number 1 day, 1 and drum, number 1 night. So be careful, because this patient maybe it's coming for the 15 of night upper and 13 of day lower. So it's not for all the patients. It's for the patients with confidence and complaints. So this is important. But it's too faster. I have, for example, my receptionist with this, because it's not wedding. They have it's married. So she's using this, and the first refinement is 6 aligners. Only 6 aligners refinement, only for a little movements. The GS package. This is another amazing package. This is for mandibular abutment in adult patients. For adult patients. I know this is complicated because how many of you are students of postgraduate? How many of you are students, postgraduate students?
Yeah.
You know, maybe you don't. Okay. How you explain the growth? Do you think the mandibular advancement is possible in adult patients? What's the theory? Is it possible or not? What's the theory? For when I study, it's not possible for adult patients because normally the idea is when the patient have the growth, no? Normally between 12, 13, 14 years. That I studied like this. It's not possible. So this changed my mind. It's possible to do mandibular advancement in adult patients because it's not growth in mandibular, mandibular don't grow. The growth in adults and the growth in adult patients. It's the condyle. The position of the condyle is the belly of the movement. So you need to change your mind. When I start to use GS, I start to go to the conference from Professor Gangshen. At the beginning, I said, one second, mandibular pattern in adults, it's not possible. But in my time, for example, my
ถ้าฉัน
professor
ลืม
they
ขออี
say
ใบโรงแรมมา
the
ไม่
same
เป็นไรหร
thing.
อ
For example, with the
จะใช้
patient
booking เหรอ
in early age, it's not possible doing mandibular advancement in patient with 7 years old. It's not possible. Only when you have a pubertal growth, maybe 12, 13, 14. But I start using clear alignments in patients with 6, 7, 8 years old, and the mandibular advancement is possible. So why is not possible in other patients? So I start to do it, and it's amazing. So the G is special for reduce or avoid restrictions or surgery, or patients that have a profile, very asymmetric profile, and you have two different mandibular advancement with AES-TD, extreme block appliance or half appliance. But we have different mandibular repositional device, like S9, like anterior or posterior. And this is the active mandibular retainer. It's special for HTV. Is a combination from HB, the hertz, with the occlusal plane, anterior occlusal plane. This is the retainer for patient for 9. So, which are the difference between a smart and Invisalign? Because always we need to compare, no? We offer different brands. So in this case,
Hello.
Smart, for example, one of the things, this is true, you know, when the Invisalign patient, when they start to use maybe 3 days, 4 days, and if the patient is small or maybe taking tea or coffee, in 3 or 4 days, in this case, you can see here, in 2 days, 48 hours, the aligner is dirty. Invisalign is very dirty. In fact, I have patients that they don't want to use more than 4 or 5 days because it's very, very dirty. Dr. Line, I want to change. No, you cannot change. You cannot use at least 7 days, maybe 10 days. No, I don't want because it's dirty. It feels good. Just more with the aligner. Just remove when you're. I don't want to remove just more. Okay? Because you need to choose. Or you a day and just more with them, or you remove. But if you are using like this, in 2 days, in 48 hours, it's dirty. Smarting is very clear. Sometimes I have the problem because the patients come to my office, okay, remove the liners, and I see the line, it's like new. They say, okay, this is new, this is for today. No, doctor, this is for 10 days ago. No, this is new. You start today. No. My change is today. So it's perfect. It's very perfect. So, the other, the business. It's not for the patients, but you have a fantastic marketing tool. The different solutions. In Invisalign, you have compressive packets, or maybe moderate packets, or maybe light packets, or maybe first. But it's the same. All is the same. In Smart, you have GE. In GE, you have Mini, Light, Express, Infinity. You have Alpha, Day and Night. You have GS for mandibular advancement. You have Kinder, 3 until 10 years. You have Teen. Teen is the only brand that you have a special package for Teen. It's the only they have a special package. And all of these you can to combine with business. So, this is Professor Gangshen. Professor Gangshen is maybe one of the most important orthodontists in the world. So, he's an amazing doctor and amazing person. So, he's the top 200% of scientific globally. And he's the first doctor to introduce the mandibular advancement in clear lines. So when the professor has in Smart, he have the 2 kinds of different mandibular advancement with TD, twin block appliance, or with HB, with hertz. The other brands, they don't have nothing. In fact, Invisalign, maybe, I think, maybe 8 or 10 years ago, when they started with the precision wings, the precision wings is not only a fake copy of the professor. The professor was the first with this. But not only Invisalign, Angel Aligner, if you don't right, Angel Aligner, they have the TV solution. I think the name is A6 solution. The A6 solution is from the professor. Professor at the beginning is working with Angel Aligner. So with difference with the brand, they changed to a Smarty. Smarty gives the professor all that he needs to make an innovation. So the professor with Smarty have the new mandibular bag with Louis block. The Angel Aligner was the first, is the initial, so it's old, and this one is the new one, and the HB, before Invisalign. So, the professor treated more than 100,000 cases with mandibular advancement. Only with mandibular advancement in adults. So, I have, if you want to scan this QR, you have the presentation with all the professor, not all, because it's complicated all, but the most important articles. This is not my work, this is science behind it. This is the professor, you have articles, you have papers, you have all the work. And you have, you want the website registration from and the manual. So, but this is for me, this QR is the most important. So, for example, this is a case for the professor. Class 2 malocclusion, 2 years of treatment, adult patient with class 2 division 1 malocclusion, treated with clear aligners and mandibular advancement. Okay. When I meet the first time with Professor Ganchen was in Madrid, in a course, and I really shocked with, okay, mandibular advancement in adults, how it is possible. So the next time we go to China and see all the professors, so the different cases, and I'm in love with the system. Okay, I want to try, I want to use. This is in Chengdu. For example, you know, in Spain, the annual meeting of the Spanish Society of Orthodontics, normally we have 600, 700 people normally. When you go to China, normally this is a normal day in Chengdu, it's around 1,000 doctors to see the professional lecture. In Sichuan, it's another, same 2 times in China, 1,200 doctors. So it's amazing. So it's true, you go to China, in a little town, it's 8 million people. So in Spain, normally a little town is in 60 persons. So this is amazing. And this is the professor office. We have in the center of Shanghai with 3 floors. Total, I think, is 80 chairs, 25 for general dentist and aesthetic, 25 for implants and surgery, and 25 or 30 for orthodontics. Amazing and amazing. And the team, all the doctors who work with the professor are an amazing team, very amazing team. It's not only, they do not only Smarty, they do lingual orthodontics or traditional orthodontics or whatever. So, but we say we have 2 kinds of mandibular placement, 2 different devices. So when it's recommended to use one or the other? When do you think it's recommended to use the HB or TB? The professors say when you have the 3 Ds, deep overbite, deep overjet, and increased true spin, you need to use the twin block appliance. I think it's only, with this is only 2 important. It's increase overbite, and normally with an increase overbite, you have a increased true spin. So this is indicated the twin block. If you don't have increased overbite or increased true spin, HB. This is the difference, the TB, the twin block, and the HB. TB, increase overjet, increase true spin. HB, no overjet, increase overjet, no increase true spin. So, you need to say a clinical case. This is Alba, It's a patient with 21 years old at the beginning. So this patient was treated 5 years ago with traditional appliance, with braces. So you can see the smiling is very beautiful smile. So what's the problem here? The profile. The profile and an intraoral view, the overview. So this patient have two problems. The first one, the class 2 malocclusion with a reduction of the mandibula. The second one, have an habit. You are speaking with the patient, and the patient is talking to you, and is with the tongue. So maybe we don't know if this is a relapse for the tongue, or maybe they don't correct at the first treatment plan with this class 2. So you can see the art form is very good in both. So when you have the occlusion, is class 2, in fact in the scanner you can see class 2, complete class 2 canine, near from complete class 2 molar, and you will say the same, class 2 canine, class 2, complete class 2 molar. So I don't know why this 7 is not aligned with the first treatment. So this is the orthocontrol of it. The patient has agenesia of the lower third molar. I ask the patient, you need to extract this upper third molar. It's not mandatory. It's not mandatory because it's not for you, for the treatment, it's no problem. But at the end, you need to extract. Until right now, she doesn't extract. So sometimes you need to do is mandatory to extract because the patient will say, okay, it's not mandatory, I don't want to extract. So at the end, you know what the problem with this, no? With the time, this is a young patient, who's 1 year old, but with the time, this molar will have to go antagonist. If no, they will just try extrusion until the molar is touching the gingiva of the lower. So this is the profile, and this is the lateral cephalometry. So the inclination of the upper incisor, the inclination of the lower incisor, and the clasp. So pay attention with this. Where are the TMGs? This is the CBCT of the TMGs. Do you think the TMGs is in the right position? Which is the ideal position of the TMGs? The ideal position. The center relationship. Of course. What is the center relationship? Is there posterior, superior? Do you think this ATM, this condyle, is in the center relationship? No, it's outside. It's near from outside. So, we have a problem because the patient is a class 2 malocclusion, but is very young patient. But maybe in a few years, with this position of the condyle, this patient will have a problem. So, what's the treatment plan? In this case is HB. Why HB? Why Hertz appliance? And come back. We have increased overlap? No. We have increased QSP? No. So the ideal device is Hertz appliance. So this is different one. This one. And this is with the wax restation. You know, when you are using the wax is not appearing in the scan. You use the wax, and there's some different kind of wax. You can make a wax. I normally use a wax like in two blocks, right and left, so right and left. So I use the patient, put in the ideal position. In this case, it's very important to differentiate the initial malocclusion. For example, you know, another brands, when you are using like mandibular attachment, they always give you the same position, H2H. But H2H is not the ideal position for all the cases. For example, if you have a class 2-1 malocclusion, do you think the ideal is H2H? No. Why? Because the upper incision, you need to do a retroinclination. So if you give H2H and you after this, you're doing the retro inclination, you are going to create an anterior crossbite. So in class 2-1, you need at least to give 1 or 2 millimeters of overdeep. Because you're thinking you need to recontract this incisor. So in class 2 division 1, you need to leave at least 1 or 2 millimeters. Okay. In class 2 division 0, well, division 0 for me is when you have the inclination of the incisor in the right position. In this, for example, this is H2H. This is the better way, H2H, because the inclination is correctly. But what happened in class 2 division 2 malocclusions? Forward incisors, retro inclination. If you are going to do H2H, when you are doing the pro-inclination of incisor, your grades are overlaid. So in this case, in class 2 division 2, you need to make a 1 millimeter crossbite with the wax registration, because you need to think in the future, this incisor they want to pro-inclination. So it's different. So be careful, because some brands they give you, okay, it's 2/8. No, it's 2/8, no. You need to do with wax what they ideal, your ideal position of the mandibula for this mandibular passage. So in this case, I leave like 1 millimeter of overlay, okay, to retrograde. And this is with the wax. The wax, that's not a big. Normally I use 2 blocks. Okay, with the patient mandibular advancement, I have the ideal position. For example, I'm going to scan the left side. I take off the left wax and only have the right for the stabilization. Doing the scanner, when you finish the left side, you put the wax here, remove the other, and scan the other. And you have your scanner with the mandibular advancement position. Okay, and this is the treatment.
แล้วแต่ว่าเป็นขาถูก
So,
ถ้ามีคอนเนคชั่นปกติ
what happened, for example, with the mandibular advancement? What is
เพราะฉะนั้นควร
one of
ทิ้
the
ง
most
หัวเจ็ดไว้1 มิลลิเมตรถึง 2 มิลลิควรจะ
effects of
แต่ถ้าเกิด
mandibular
ขาด
advancement?
ถูก
What happened with the
มัน
lower
กัด
incisor?
ให้มีความไหล1 ถึง 2 มิล
What happened? When you're doing manual advancement, it doesn't matter with the system. There are liners, twin blood, Bionator, Frankel, Clamp, doesn't matter. What did happen with the lower incisor? The pro-inclination. Sure? So, normally, how can we avoid this pro-inclination? It's complicated. So, this solution is something we have only in the SmartKit. The SmartKit have the lip bumper. The lip bumper, which is the traditional lip bumper. Any of you, I think it's younger, you use the lip bumper in any case, the traditional lip bumper? No. Okay, you're lucky. But the traditional lip bumper, normally, the idea is to remove the force of the lower lip, and this is to maybe to better the pro-inclination of the incisor. It's the opposite of this system. For example, I used 23 years ago the lip bumper in case for extraction cases to anchor it, for example. Or the fecal patient have out of clothing for the force of the lip. Okay. But this, for example, this lip bumper is the opposite. So this bumper is to avoid the pro-inclination. So normally, not in all my cases, but maybe in most of my cases with mandibular advancement, I always use this solution. S2 solution, lip bumper, to avoid the pro-inclination of the incisor. It's free, they have no cost. So you can use, and you can use in young patients, growing patients, or your patient. It doesn't matter. You can use in all your cases. The second, what's the problem with this patient? Have a child habit. No, explained you before. She's speaking with you, and it's the tongue outside. So in this case, I use. What is this? Concrete. Concrete for control distance. It's true. Maybe you go to the specialist of the tongue or whatever, but it's another tool that we have to use to combine. And of course, the health appliance.
มันไม่ใช่เล็ก
And
เป็นดีกว่าเปิด
what do you think
มัน
is
จะคลาย
better?
เอาไว้
Doing the movement mandibular in one step or step by step? For example, when I started using Invisalign, mandibular advancement, always say, no, it's in our system, we do every 8 aligners, 2 millimeters of mandibular advancement. When we finish 8 aligners, the next 8 aligners, another 2 millimeters. Which is the science behind of this. Did you read any article that is better doing step by step? No. When I studied all the twin block from Clark, the Pancher, all the classical articles is step by step. No, it's only one step. It's true. The patient has 40 millimeters of overjet, but one step, the patient maybe have a lot of pain. So normally it's one step. This is the idea for the growth from the removal of the colon. So in this case, it's one step, only one step. So here we are combining the acid solution, mandibular advancement with hertz appliance, with the tongue cream, with the lip balm, and of course, IPR to return climb incisors. Okay, so this is the evolution of the patient. Aligner 19. You can see here the liner, the tongue cream, the lip bumper, and the hertz appliance. And here you can see this is the number of the patient, and the L lower, and 19
มันเดี๋ยวเวลา
is the aligner.
เออ
So, in maybe 5 months, we have near or class 1 molar,
ต่างกันยังไง
still class 2 little class 2 malocclusion canal. In the left side, class 2 malocclusion, and here from class 1. Only 5 months. Okay. The scanner, ortho, and here in 5 months we are doing the retention of the incisor, and now it's class 2, incomplete class 2. So, aligner 40. This is in March.
ต้องเรียกยาวปะ
10 months of treatment.
ตัวกู
10 months of treatment. We have class 3 on near, or maybe we say super class 1 malocclusion molar, class 2 canine, and here class 2, so class 1 molar and class 2 canine. But what happened here? But my midline, in all the treatment was perfect. And right now, have a deviation of midline. What's the problem here? This is a problem of mine, because I only left 1 millimeter of overjet. So what's the problem right now? The patient have contacts, anterior contacts. So these anterior contacts is not possible to move the mandibular in the right position. So I need to do refinement to maybe a little more IPR, asymmetric, to this mandibular to advancement, and have, because if this mandibular goes to the right a little, I correct this class 2 malocclusion in the left side. So the problem is I have no open. But for example, you can see the ortho and the telegraphy here from class 3 malocclusion in adult patient. So we make the comparison. In the orthopalmic tomography, maybe it's not a lot of change because we don't move a lot of the roots. But in the cephalometry, you can see May, March, the different inclination of the incisor, the position of the mandibular, and the VTO, and the morphing of the position of the mandibular. The profile, very nice profile. It's better profile. We increase the nasolabial nerve and the metalabial nerve. And the occlusion, that is better. But for me, what is the best change of the patient? This is the best change. You can see here in my 24, where is the contact? Outside or near outside the glenoid fossa. Right now, where is the mandible? Where is the condyle? In the centric relationship. And you can see here, start revolution of the condyle. It's true that the professor can say, when they say we need around 12 months to see the ideal revolution of the condyle. But in 2 months, in 10 months, we have the and the position of the condyle. You can see here. Now we see the ideal position. So we are doing very good power. But this is not magic. This is science. And this article of the professor, the biology of the TMD growth modification, basically mandibular condyle growth in response to mechanical. For example, when I study these two books, you read these books, Essential of Facial Growth, they're from Enlow or Ramley. Did you read? No? Okay. I recommend you to read these books because you are going to learn a lot of how it works the growth. When you think how the bones grow, of course, of the craniofacial, how it grows. Normally, we think that the bones grow lower and forward. Sure? Good thing. No. The bone grows
upward, backward.
upper and back. So, on the shoulders, the position of the direction is opposite. But the bones grow upper and back. So they change the position lower to forward. So this is the same. If I have the condyle in this position and I move the condyle forward and down, the remodeling of the bone is up and back. So this is the theory. It's not magic. This was good, Professor? Yeah? We need to stop? Yes? Okay. So, do you want to stop right now to make a little rest and start again?
Yes.
Perfect.